Yes, so good afternoon, good morning, and good evening, colleagues. Welcome to our APP3 meeting. Let me start by introducing myself. My name is Dr. Tokmo Maruta from the Africa Centers for Disease Control. I will be chairing this session for today. As you know, Africa CDC co-chairs this group together with the Republic of Uganda, which is also represented here by Dr. Peter. Dr. Peter, can I give you a few seconds to introduce yourself to the group? Okay, so Dr. Peter had indicated that he's in a place where connectivity is not very strong. But however, welcome to our meeting. We'll straight away go to our roll call and thereafter go into our first agenda item. So if I'll call up the name of the member states, if you are present, just indicate so. Then we'll move on to our national and international organizations. When I call up the member states or those that are present, please just quickly introduce yourselves. Argentina.
Hi, Mayra Meneiros here.
Thank you very much. Australia.
No, it's just all that I have to say. I think we need
Azerbaijan. Bangladesh. Barbados.
Good morning. I'm Gail Trotman from the Public Health Lab in Barbados.
Welcome. Thank you very much. Belize.
Hi, good morning, everyone. Celso Carrera from the Central Medical Laboratory, Ministry of Health.
Thank you very much. Canada.
Hi, everyone. Michelle McLaughlin from the Public Health Agency of Canada.
Thank you very much. Cape Verde. Denmark. El Salvador. Finland.
Good afternoon. This is Simon Ikkari from the Centers for Military Medicine and Biothreat Preparedness in Finland.
Thank you very much. Germany.
Yes, hello. This is Amelie Blüme for the German Federal Foreign Office.
Thank you. Ghana. India. Indonesia. Kenya. Jordan. Mali.
Hi, everybody.
Thank you very much, Prof. Malaysia.
The next meeting discussing
Netherlands. Nigeria. Peru.
Good morning, Ernesto Gosser from Peruvian University, Cayetano Heredia.
Thank you very much. Portugal. Republic of Korea. Saudi Arabia. Singapore. Spain. South Africa. Tanzania, Thailand, Uganda,
Present.
thank you, United Kingdom, Ukraine,
Hi, this is Anna Prihodko from the Public Health Center of the Ministry of Health of Ukraine.
thank you very much, USA,
The USA is here.
thank you very much, APTA,
Lisa Chua from Maps International. Good morning, everyone.
thank you very much, ASLM, ASEAN, Africa CDC, that will be me, from the BTWC.
Hello, everybody. Remy Bakuya here for the PwC.
Thank you very much. Kappa,
Good day, everyone. Sasha Wallace Sankar Singh. Greetings from Trinidad and Tobago today.
thank you very much. Chatham House, Sierra DF, FAO, EIEA, IEGBBR,
Hello, everyone. Leanda Winter here.
thank you very much. IFBA,
Yes, Maureen Ellis here from IFBA.
thank you very much. IGEM, OIE, American Company,
I'm Mike Krug here from Merrick.
thank you. NTI,
Hi, this is Stephanie and Jacob from NTI.
thank you. UNICRI, VETIC, and WHO.
Hello, I'm Kaz Kojima from WHO headquarters in Geneva.
Thank you very much. So thank you very much for those who have made time to join us in this meeting. We'll quickly move on to our first agenda item, where today we have the privilege to have Dr. Olivia Tulloch, who is going to give us a presentation on the role of social science in biosecurity. Dr. Olivia is the CEO of Anthropologica, which is a research-based organization that specializes in applied anthropology for global health. It is also the recognized global leader for the integration of social science research to epidemic response. Dr. Olivia is also the co-lead of the Social Science in Humanitarian Action platform, which is known as SSHAP for short. If possible, to give Dr. Olivia the right to share the screen so that she can make a presentation. Over to you, Dr. Olivia.
Thank you so much. I just want to try to share my screen. Trying to. Do I have permission? Looks like I don't have permission.
Dr. Tulloch, I just made you a co-host, which should give you permissions.
Okay, let's try. There we go. Can you see my screen or see some of my screen?
Yes, we can.
Just try and get this the right size and we'll go ahead. One moment, bear with me. There we go. Thank you so much for inviting me. Just one moment. And so thank you for the introduction as well. And also to Dr. Issa from the Uganda Ministry of Health, who proposed that I joined you today. I've been asked to present my considerations on the role of social sciences in the biosecurity and biosafety space in which you're working. As mentioned, I'm the CEO of Anthropologica, and we work in applied anthropology in the health sector. And much of our work is relating to social science evidence during disease outbreak responses or indeed preparedness. But why have I been asked to talk about social science in this forum? Well, I'm informed by colleagues that there's often really still relatively poor understanding of the potential uses of social sciences by experts from other disciplines on partly how to integrate it into epidemic response, but more broadly into into biosecurity and biosafety matters. And what do I mean by that? Well, we often still see relatively low contributions of social sciences during disease outbreak responses in many parts of the world and in our institutions. Many institutions do not allocate substantial funding for social science research or personnel. And we hear from colleagues in the biomedical and epidemiological disciplines or from lab disciplines and so on, that they don't actually accept the validity of social science methods or recognize the need. Yet we know, and I will explain how we know, that social sciences are a crucial part or a crucial aspect of epidemic response, and I believe in advancing biosecurity and biosafety. I'm going to draw on the experiences from our work today and then try to relate that to biosafety and the global guidance framework for the responsible use of life sciences that I'm sure you're all aware of. And I imagine that many of you may know that that framework states that preventing the misuse of life sciences and biology is not a new issue, but it requires a multidisciplinary approach. So I'm going to talk about how social sciences are part of that approach. So I'm not a regular member of this group. So before I start, I've got a couple of questions. And I think that today in this session, we're from fairly mixed disciplinary backgrounds. There were certainly many acronyms that were new to me in the introductions. So I'm curious to know, and perhaps you could put your answers in the chat. Question one, do any of you see yourselves as social scientists, or are you social scientists? And question two, if not, do any of you use the social sciences in your work? So if you just put your answer to that in the chat, and I'll continue anyway, and perhaps we can reflect back on that. So for those of you who are not, what do we mean when we talk about social sciences? In their broadest sense, they're the study of human behavior, how we interact with one another, how do we develop as a culture, how we influence the world. There are many interrelated disciplines within it, maybe sociology, anthropology, psychology, economics, political science, and so on. And in the last 15 years or so, there's been a clear recognition that there is a need for responses to disease outbreaks to look not only at biomedical, but also epidemiological aspects, as well as that they should appreciate context and take into account social, cultural, and political factors. And this became really evident in the HIV epidemic in the 1980s, you'll remember. Well, many of you will remember, I'd have thought. And that response initially took a really biomedical approach. And of course, that was crucial. However, progress really only occurred when we understood and addressed the social context and the behavioral factors that were also having an impact on HIV prevention, care, and treatment. So in that realm, social sciences were crucial to inform how we could increase uptake of testing and counselling or address stigma that prevented people from seeking treatment. So alongside the medical advances, this is a major example from the last century where social science knowledge and expertise was really invaluable. The West Africa Ebola outbreak and the response to that is another strong example where success in tackling the spread of the epidemic required strong biomedical and epi interventions backed up by social science evidence. So let's illustrate how these disciplines interact by, I'm going to give you, before I go to the details of this slide, I'm going to give you a brief example relating to prevention of disease transmission during an outbreak. So each discipline I mentioned brings its own perspective, and we bring these together. So let's use this example, that we would like to understand why people do or do not decide to follow public health guidance, such as the instruction to use a face covering to reduce COVID-19 transmission. So with this example, we can investigate maybe first through sociological and psychological methods, that maybe the research will tell us that people don't trust the institutions who are promoting the guidance. I'm sure that's something that many of you can relate to and you've heard about in your communities. If we look at the same question through anthropology, we might understand some of the causes of the distrust. So why, for example, a given population feels marginalized and therefore doesn't follow the guidance. And if we look at political science, we can understand how local government practices work, or how power is shared, and how those factors interact with people's behaviors and their willingness to follow the guidance. Only when we understand those factors can we develop the approaches to mitigate the poor compliance. So that's in a disease outbreak, but those are principles we'll look at in biosecurity and biosafety as well. But generally, within a disease outbreak, social science provides a number of research approaches. I've got them listed here, and we can apply these to many areas within the health sector. So let's think of some of the questions. It could be how people think and behave related to a disease in question, and what are the barriers to them acting positively. What knowledge or resources those people have that could help mitigate the outbreak. What is the degree of trust people have in services or in policies or in guidance, and what information there is related to the issue. What do people believe? What do you believe? What are your social cultural norms and your traditions that might influence your work or efforts to reduce disease transmission? And then what do we do with that? How do we raise awareness and actively engage people? So what are the social structures, the social networks, and so on? So we do social science research to answer those types of questions and use the information to adapt the design and delivery of our work. Now, I'm just going to use this photograph to illustrate the point about a disease outbreak and how we may come into a disease outbreak with the highest level of biosafety measures, but we should always think about the context that we are trying to, in which we're trying to introduce those measures and the impact that they may have on a population. So I think you can agree that if you live in a poor district in Monrovia, Liberia, which is where this photograph is, that this might make a terrifying scene. But just look at what the Red Cross team here are doing. They're holding their hands in prayer. Just think perhaps this is an additional layer of protection to their PPE, or so they may perceive, and they're praying before they enter the home. So I just want you to think about who the individuals are in our work and how they act, and how that in itself affects the efficacy of our work, be it in biosafety, biosecurity, or whatever. Now, social science has a stronger position these days in the global health stage. And the necessity of social science expertise is recognized in the 3 stages of the health security agenda. So, for example, it's recognized that social science is needed to prevent and reduce outbreaks, be they natural, accidental, or intentional. It's important for protecting threats early to save lives, and to respond rapidly and effectively using multi-sectoral coordination and communication. So biosafety and biosecurity is also ultimately about human behavior. All of our work is ultimately about human behavior, and human adoption and human adherence to biosecurity and biosafety practices is influenced by the factors I've just outlined. So thus far, and at least to my knowledge, and here you may correct me if I'm wrong, but the potential importance of the social sciences in this realm is not yet really fully responded to. And I understand that's why I've been asked to join you today. And the global guidance framework states that to actively involve social science and humanities disciplines in the design and pursuit of basic and applied life sciences, consistent with the recognized value of interdisciplinary research. Now, I do not yet know if there has been formal inclusion of the social sciences in the GHSA work around biosafety and biosecurity. But if so, I welcome your submissions. And I think perhaps we'll leave that to the end when we've got a bit of a chance for some backwards and forwards between us. But let's have a look at the role that social science has in attaining the targets of biosecurity and biosafety. There are 5 targets, and I would, no, sorry, there are 3 targets, and I would argue that the social sciences have a role in targets 2 and target 3. So that's in the risk management training and educational outreach related to getting a culture of responsibility, to reduce dual use risks, and so on. And the last one, which is country-specific biosafety and biosecurity legislation, licensing, and pathogen control measures appropriately in place. Appropriate is an important word. So we need to think about examples of how this is happening so far. So I'm going to present my outsider's perspective and think about how I think social science may contribute in your space. And I see these as being illustrated in 7 areas, the first 4 on this slide. And these are just a starting point, just to stimulate some thought and discussion. So for those of you working with pathogens, the global guidance framework states the need to increase awareness of biorisks, providing incentives among scientists and technologists and other managers to identify and mitigate risks. So here, social science can be used firstly to understand the awareness and the attitudes in your realm towards the risk, looking at the perceived vulnerability to the threat. And then it can be used to look at the influence of the social incentives in your workplace or beyond, and those norms on individuals' behaviors relating to those risks. And then next, on the psychosocial influences, things like the motivation. So the role that the threat perception has in engaging protective behaviors or other biases relating to assessment of a risk in our behavior. And then the last one in this section is looking at insider threats. And I think this is particularly important in the space of biosecurity, and thinking how people's personalities, people's thinking styles, their social factors impact biosecurity in a positive or negative way. And it's really important that institutions do this, even though they may be reluctant to think that those threats are within an institution. That's something that I've been particularly asked to reflect on. So looking at those 4 areas where social science can contribute, what we would do is then use the findings from the social research to adapt the design and delivery of the training that we've been told is needed, and the educational outreach strategies, which are target 2, and also the pathogen control measures, which were target 3. So that might be, for example, on the provision of incentives, or on human resources screening of staff looking for warning signs, and so on. Okay, so my final slide then, let's think about how social science can strengthen the wider biosecurity system. And here I'm going back again to the global guidance framework, which describes how, and I'll read again, concerns about biorisks extend beyond those working with pathogens. That's research organizations, funders, lab technicians, professional societies, data managers, curators, publishers, ethics committees, repository managers, civil society. Okay, so here what can we do? We can analyze who the stakeholders are and raise their awareness about those concerns I just mentioned. So mapping stakeholders to produce education awareness that's relevant to them, and also localize the materials and perhaps identify what we can call champions about biorisks. Then when it comes to ethics, about those of us involved in promoting ethical research or ethical practices. So upholding the regulatory systems and medical ethics, we can think how social science can promote responsible conduct of life science research and the oversight of the dual risk issues, particularly during public health emergencies and outbreaks, when we know that government and ethical clearance systems are often not functioning as they should or as quickly as they should. And then my final point is about engaging the wider public. And there's a value in the global guidance framework, which is on public education, engagement and empowerment. And apparently the framework says that we should be, you should be educating civil society networks about the benefits, harms, limitations and capabilities of the life sciences, and engage civil society in deliberations about future uses of those life sciences. So social sciences can provide methods for having done research on these matters in how to engage about these things with communities so that people participate, collaborate, and there is trust. Those approaches can also help understand and integrate public opinion into policy, and that would help achieve one of the other recommendations in the framework, which is to promote public trust. So there are some starting points from me on how social science might be integrated into the work of this group. I welcome your thoughts. I welcome knowing what you're already doing and any questions that you may have. Thank you very much indeed.
Thank you very much, Dr. Olivia, for that very comprehensive presentation on the role that social science can play in biosafety and biosecurity. I think you were very clear right from the start that there is indeed a very limited understanding of the use of social science, especially in the sphere of biosafety and biosecurity, and also broadly in epidemic response. You cited a very good example of West Africa Ebola outbreak, how a combination of both the biomedical plus the AP responses combined with were backed up by social sciences in order to mount an effective response. So thank you very much. And you also highlighted how social science can be used to also achieve some of the global health security agenda targets. And you spoke much more specifically on targets 2 and 3 and how social science can be used to help us achieve those targets much more efficiently, including that social science will help us to understand awareness and also underlying attitudes towards, for example, biosafety and biosecurity, understanding the influences of social incentives, social norms, as well as also understanding psychological influences, as well as insider threats, stakeholder analysis, and public education. So thank you very much for that. I also saw that there were some active contributions on the chat where some of the members were indicating that they have some experience of including social science in some of their programs, but some also indicating that this is an area that they need to consider much more strongly as they move forward. So let me give some minutes for anyone who has a question. You can indicate by raising your hand, and then I'll give the floor to Dr. Olivia. So I'll start with Michelle, and then after Michelle, I'll go to Luis, and then hand over to Dr. Olivia for the response. Michelle to you, and then Luis.
Thank you. Hi, everyone. This is Michelle from the Public Health Agency of Canada. You raised a very interesting point related to insider threats, and I just wanted to point everyone to a resource that Public Health Agency of Canada has prepared on insider and outsider threats. So it's a course that was developed that describes some of the motives, tactics, and indicators of these threats. And I'll place a link to it in the chat in case anyone is interested in looking into it further. Thank you.
Thank you very much, Michelle, for sharing that information. So colleagues, pick up the link on the chat box. So let's move on to Luis.
Yeah, thank you so much. Very interesting presentation. Based on the current situation with COVID-19, but with other infectious diseases, from your perspective, how can we eliminate, I know that this is a very difficult word, but how can we eliminate the cultural and language barriers and help social sciences to achieve their goal to have a better communication, but also a better understanding from different stakeholders? Thank you so much.
Thank you, Luis. And just before I answer the question, when you say cultural and language barriers, are you talking within a country or internationally?
I'm talking about internationally and inside of a country, because we have different groups sometimes inside of the country that do not communicate effectively. So yeah. I think that my question is for these two things.
Okay, I think at the local level, the important thing to consider is that whenever you're communicating, you want to communicate to the smallest target possible. So we cannot use the same language to communicate with everybody, right? But people respond to things in different ways. And so one of the ways that's really useful to communicate is if we're talking, as you say, about COVID-19, but it would apply to Zika or Ebola or something else, is think who needs to know this information and where do they like to get information from? Well, what do they listen to? Do they listen to commercial radio? Do they get their information from the church or from the mosque? And then think, if that's the information that they trust through those sources, use those communicators as your voice box. So you may have a public health message about trying to promote positive practices, but if it comes from the voice of the Prime Minister and the Prime Minister is not trusted, his language or her language is not going to be well accepted. However, if it's somebody you trust, be it your health professional, your imam or your priest, and they speak to you in words that you understand, and it's really about going through a process of translating from scientific speak to speak that people feel comfortable with themselves. And so that means that when we have global guidance on things, and I know we've got people from global institutions here, that at national level and at subnational level, we also need to do a kind of process of translating that for all of the different target audiences who need to believe it. Do not think that everybody needs to hear the same language. I hope that answers your question in the way that you hoped. Thank you.
Yeah, thank you so much.
Thank you very much, for Luis, for that question and for the response. I think very important point that we normally forget. We usually craft very nice messages, but forget the most important thing as to who needs to know this information and what is their most trusted source of information, so that we can utilize those channels. Mr. Atek, I see your hand. I'll give you the floor for your question.
Chair, thank you so much, and thank you, the presenter, for that brilliant and fantastic presentation. One is a comment that we need to have social sciences in the planning, that is pre-event, during the execution, and also after the event. So we need to have it throughout the whole process. Then two, the question, how do we separate or delineate between the social sciences and the risk communication and social mobilization? Because we have been priming the risk communication and social mobilization. They do these KPAs, they do these short studies, and they're able to know what's happening in communities. And I think they are insufficient. But how do we separate the two from her technological point of view? Thank you.
Thank you for the point, Atek. So first, on your first reflection, I'm really delighted that you have social scientists in this group, because maybe you didn't need me here at all, and they would have done a much better job because they know the space better than I do. But at least that means that now you're in a position to make sure that you do have social science in planning, execution, and response, and the follow-up. So just by virtue of already having social scientists in this space. So I think you're sort of well set up for that. But your point on risk communication and community engagement, this is really important, because so often social science is thought that it's only useful for this realm, for this idea of communications. There's so much more to it than that. So it's not necessarily about separating it, but looking at the different areas in which social science can contribute, of which communicating is one of them. And I would be reluctant to say that when it comes to the methods that are used for understanding people's sort of risks and perceptions and things, that CAP surveys are sufficient. It really needs to be more than CAP surveys. And I think you did say CAP surveys, but really we need to back those more quantitative approaches up with more detailed qualitative approaches to really understand what underlies the data that we get through CAP surveys. I hope that helps. Over.
Thank you very much, Olivia, and thank you very much, Mr. Tick, for that very important question, and for the clarification. I think that when you look at social science, it's much broader than communication, and it's a matter of ensuring that this is included, as we have said, both at the before, during, and after the response. So thank you very much, Dr. Olivia, for this very informative presentation. It was very educative for most of us who were following you and listening. So in the absence of, thank you. In the absence of further questions, we'll quickly move on to our next agenda item, which is to look at continue our discussion on the work plan for our action package. Let me also take this opportunity to say, as the core team for this package, we have mobilized and put together the ideas that came from many of you to come up with the work plan. And in one of the requests, we had indicated that we were requesting for members to volunteer to lead some of the areas in our objectives. I'll quickly run you through the work plan and indicate areas where we have not yet had some volunteers to take lead in some of the priority areas. So on the first priority area, on expanding our action package network, where one of the action is engaging current and recruiting new members, we already have NTI volunteering to take the lead. They also, under this priority area, on the action package contact list. So as our secretariat, they will take lead in ensuring that our list is already up, is continuously updated and circulated with all members. When it comes to developing and executing the plan, there is an action of submitting the proposed activities to the package chair. So we are all should take responsibility to do that. And then when it comes to consolidating the overall activities into the action package for submission to the action package leadership, our secretariat NTI will take that lead. However, we need to develop monitoring and evaluation framework for this work plan. This will help us to ensure that our work plan, we are in progress, and where we are not in progress, to continuously review if there are challenges. So we have not yet had a volunteer to come up and take up this responsibility to work with the co-chairs as well as the secretariat. So we are looking for either members that are here or institutions that have a strong expert or bias towards M&E to volunteer for us to take this lead. And then the quarterly review, NTI as our secretary to take lead in that. And then in terms of updating the terms of reference, there's a session that we're planning to do together with the leadership, and the co-chairs will take lead on that. Then whatever updates are done, this will be circulated, and the co-chairs will be responsible for that, and then submitting the final terms of reference based on the meeting that we have, and the co-chairs will do that. On promoting the work of the action package, and also ensure that there's furtherance of the goals of the AP in alignment with overall GHSA objectives. So there will be webinars that will be scheduled on identified topics. The co-chairs will take lead in that, and our secretary to make sure that they coordinate the dates, and we'll submit this schedule, which we have already done, for the bigger group in terms of presentation. On the second objective, is the action on the priority on coordination of action package activities to ensure that we achieve our mandate is the APP3. So the calendar has been will need to be submitted, and the co-chairs will take lead together with the secretariat, then participate in some of the global partnership meetings, and so forth. However, we have this action on identification of common areas of work with other action packages for joint implementation and collaboration. So there was a proposal through this group that we work together with the Lab 16 action package, as well as work with the Sustainable Finance Action Package to ensure that there's inclusion of biosafety and biosecurity in all efforts. Of course, the co-chairs will play a central role here, but we're also looking for additional hands to sort of take the lead in working with the co-chairs in this action. Also on the advocacy and communication to promote biosafety and biosecurity, we also have an action item on updating the minimum requirements for our website, and there's a template that will be received. Of course, the co-chairs will take also leadership in that, but we're also looking for one of our members that are here to work with the chair, especially on updating the minimum requirements for the website and so forth. And then when it comes to developing an advocacy and communication strategy for biosafety and biosecurity, we're also looking for members that are here, institutions that are here, that have a strong experts and a strong bias on this advocacy and communication to volunteer to take part in that aspect. So we are asking, we have been asking for volunteers to do that. And then there's the submission of the stories, which will then be compiled, put together, and released on our newsletter on a regular basis. We are also looking for member states to do that. The other area where we still need also support is when it comes to conducting training and capacity building among the members that are here, to ensure that we have easily deployable research capacity within our respective regions. So to have monthly presentations on specific topics like we have done today on social sciences, we need to continuously have these from time to time. So the co-chairs, they volunteered. We also had Mary volunteering to take lead in this, because this includes, I think, mobilizing a lot of experts and so forth. We're looking for one or two other additional members to join Mary. On the fostering of legislative environment, Africa CDC, we have volunteered to be here together with CAPRA. If we are also looking for any other additional members from other regions to join, so that we can share experience across all regions and so forth. Then the development and domestication process of some of these legislative documents that are being developed. We are also looking for members that are here to assist. Members like Vetich, I think this will be a core area for you to work with us. Technical assistance on development of pathogens priority list. Africa CDC, we have volunteered here, but we are also looking for other institutions that are here. I know institutions like DITRA, Sandia Labs, they also have a lot of expertise here, and please where possible, do a volunteer. So this is our final call to the members, and where you are able to indicate now, we'll be pleased to take in your name in any of the areas I've indicated. Otherwise, we have agreed as leadership for this group that we will be sort of volunteering on your behalf based on our analysis of your expertise, and we will be engaging you bilaterally to see if you will be able to take up this challenge with us. This is everyone's work plan, and we strongly encourage participation from all of us on this group to ensure that our work can start as soon as possible. So in our next meeting, we will be presenting the final action plan with all listed leading institutions. Let me take 1 or 2 minutes for any indication or submission for those who would like to propose any of the areas indicated. You can show by raising of your hand if you would like to maybe make yourself available for any of the areas that I've indicated. Okay, Jacob.
Thank you, Dr. Talkhorn. I'm not able to commit to additional areas, but I just did want to say from our perspective at NTI, having helped support this action package for several years now, and having signed up on the work plan to already do a few things, I just can't speak highly enough for this avenue of engagement and support in support of the chairs, but also GHSA more broadly. So I would encourage others to really take a look at the work plan. A lot of the things that are part of this are things that a lot of us do as part of our ongoing efforts and collaborations in our day jobs. So I think if you can find areas where you're already engaging on something and can then just supplement or add additional work through the action package, it's a fantastic way to help tie a lot of the different threads related to biosafety and biosecurity across different fora. It really does help keep things aligned and more effective in this space. Over.
Thank you very much, Jacob. You said it better than I could, and we strongly again encourage members to volunteer for participation. Otherwise, so our secretariat will circulate the work plan one more time, but otherwise between now and the next meeting, we will be engaging some of you bilaterally to see how we can move together. So that's so much about that on the work plan. I would like to move on quickly to the next agenda item, which is a quick round of updates on activities within our action package. So I'll open this up for members that are here. Any activities, ongoing activities related to this action package, you would like to update the group that happened between the last meeting and now. You can just show by raising of your hand for any updates. Over to you. Whilst you are thinking and putting your thoughts together, I'll quickly provide an update from Africa CDC that on the 12th of April, we officially launched our regional training and certification program for biosafety and biosecurity professionals in the Africa region. This launch took place at our headquarters, at the AU headquarters in Addis Ababa, led by the Canadian ambassador to Ethiopia and permanent representative to Ethiopia, and also our director for Africa CDC, Dr. John Kengason, and also a representative from the Ministry of Health of Ethiopia. So we are excited that now this training program has been officially launched, and we look forward to the first cohort of trainings in around June, July of this year. So that's the update from our end from Africa CDC. Any updates, colleagues, from the members that are here? Yes, Jacob?
Thank you, Dr. Talkmore. And let me start by congratulating Africa CDC on your efforts. Really, truly a remarkable accomplishment that will help build much stronger capacity and knowledge base on the continent. So look forward to seeing where things go there. From our side, just wanted to provide a quick update. We did have our Global Biosecurity Dialogue workstream meetings this week, which many of you were already a part of. And once again, thank you for your participation. I think for the meetings themselves, we had a fantastic discussion across all three work streams, talking about things like transparent and non-retributive reporting streams within laboratories and lab systems, sustainable financing for biosafety and biosecurity, and other topics. So just wanted to let everyone know that happened, and we will provide a more detailed update to come, and we'll put a paragraph in the minutes with more information. Over.
Thank you very much, Jacob. Yes, very inspiring and interesting discussion on the global dialogue. And as NTI, you've done this for several past years. So thank you very much for organizing that. For those that participated in these discussions, would attest to some of the key and important topics and also policy directions that will come out of this report. So thank you very much for that update. Any other updates, colleagues? Also, from our partners that are here, APSA, IFBA, IGEM, any updates from your end?
Sure. This is Maureen Ellis from the International Federation of Biosafety Associations. One exciting new project that I would like to mention to the group is looking at the issue of education in biosafety and biosecurity, and specifically targeting our youth. I think we all agree it's very important that we have dedicated career paths for young individuals who are interested in pursuing a profession in biosafety and biosecurity. So we are working with a university based in Kenya to develop a curriculum specifically for an undergraduate BSc in biosafety and biosecurity. We hope to launch the pilot program in September at the beginning of that academic cycle. Basically, students would undergo a core set of courses within their first 2 years, similar to what a biological sciences degree might present. But in the following 2 years, they would branch off into specific courses related to biosafety, biosecurity, as well as attachments in the field and in laboratories around East Africa. So we're hopeful that this pilot program can be launched in September of this year. We'll continue to keep you posted. And the idea is to take the lessons learned from this pilot program and bring it to the wider continent, across Africa, and indeed to universities globally. We'll keep you posted as we come along, and we welcome any input you may have. Thank you.
Thank you very much, Maureen. Very exciting times for the biosafety and biosecurity discipline. And we're excited that we are now looking on the education side to make sure that as people come out of these schools, they are already oriented and familiarized with biosafety and biosecurity. And we have been following very closely the initiative with the Invest in Kenya. Actually, in our last technical working group for the East Africa Regional Biosafety and Biosecurity Technical Working Group, Dr. Sakwa represented on this initiative on behalf of the university. And it was warmly welcomed by our members, and a lot of lessons learned. There was a lot of discussions and a lot of input as to some of the strategies that they can use. So thank you very much for that. Mr. Atek, is that an old hand or a new hand?
Yeah, Chair, just report that there is also a new development. We are attending a regional consultative meeting in Nairobi for biosafety, biosecurity, supported by the CBRN, European Union Commission. based in Vienna. So there is an interest to support areas of legislative framework, community awareness, and national biorisk assessments. So we hope our countries, especially in Eastern and Central Africa, will benefit from this initiative. Over.
Thank you very much, Mr. Atek, for this update. It is exciting to hear that a lot of partnership, a lot of support coming both from the region and outside to support our Biosafety and Biosecurity initiative. We are particularly happy that as the chair for the technical working group for East Africa, you will ensure that there are synergies that are created, there's no overlap, and also an aggregated approach to our efforts in the region. So thank you very much for that. Colleagues, I don't see any other hands for any additional updates. Otherwise, let me open up for any other business. I'll also ask Peter and Dr. Issa for your comments as we come to the end of our meeting for the another business. Dr. Issa?
No, just to thank you very much for steering this meeting, and also to thank Dr. Olivia for really sparing time to come and join us. And I want to appeal really to our colleagues, all the member states, please come forward as leaders and really take the challenge to be a champion of where we have gaps in our work plan. This work plan, we have really to share it with our global leaders, so to see what we are doing. And as everybody knows, AP3 is leading among all the packages. But if we really we stall, we shall now be left behind. We want to lead, and the rest of the other packages follow. Please remember, come out and stick up your neck and say, I'll be a champion here. It doesn't mean that you are going to be alone. We are going to be behind you, and we are going to work together, but you'll be, leading us. So that's really the message I want to pass as a part of the co-chair. Thank you.
Thank you very much, Dr. Issa. Yes, no room for stalling as we move forward. I see a hand, Dr. Anthony.
Yeah, thank you, Tokmo. Thank you, colleagues. My network is poor, so please confirm you can hear me first.
Yes, we can hear you loud and clear.
Okay, thank you. The information I need to pass is also seeking colleagues here to signify interest in this. The Global Partnerships Africa Signature Initiative has appointed Nigeria as a co-chair for their work group 3. The work group 3 is on surveillance and epidemic intelligence. The chair of that work group is Germany, and the co-chair is Nigeria NCDC. We had our first meeting, and it turned out that participants in that work group, we are primarily drawn from Europe. We don't have any person or participants in Africa at the moment. And if we all remember, this initiative, it's primarily for help in mitigating biological events around the African region. I will be sending information across to our colleagues who will help me make sure that across the countries in Africa, we have people who are interested in this area, surveillance and epidemic intelligence, who can now join this work group as representatives of their country, so that in our next meeting, we will have a full membership and participation from the African countries. Thank you, and over.
Thank you very much, Dr. Anthony, for that. And let me join this action package in congratulating Nigeria for co-chairing this working group under the Global Partnership Signature Initiative for Surveillance and Epidemic Intelligence. This really will go a long way in supporting other regional initiatives, including the new hub set here in Africa through Dr. Iko. So thank you very much and congratulations to Nigeria. Dr. Issa, is that a new hand?
Yes, it's a new hand. I also congratulate Nigeria, but I've already submitted names, at least from Uganda, for the Africa signature in the areas of governance, areas of surveillance, areas of proliferation. So really, I think Mark Mott, I think he has all the names, and I think each member state could also do a head hunt so that we increase the participation of African colleagues. I thank you, Chair. As I have done, everybody should do the same. Submit, do head hunt, and I've already informed the members here in Uganda that they will be contacted by Africa Signature to be part of that movement. I thank you, Chair.
Thank you very much for that and for mobilizing people to join. So Dr. Anthony, you've heard Uganda, they've made their submission, and I expect others from other member states. Otherwise, thank you very much. Apologies for the 4 additional minutes. Thank you everyone who has attended this meeting. We will circulate again the work plan for your submissions and contributions to leading some of the actions. And also please submit your names to Nigeria CDC for the surveillance and epidemic intelligence working group under the global partnership. And continue please to share your updates in terms of the works that you are doing. And I encourage you to also look at the newsletter that was shared during when the documents for this meeting were shared. And please continue to submit your stories and your work so that we can circulate this and share it among the global community. Thank you very much. I would like to call this meeting to adjourn.